Anxiety, the facts. Anxiety is a real illness and is left untreated in many. The earlier an individual seeks treatment, the more successful treatment is. Anxiety is a blanket term used to describe feelings of anxiousness, dread, fear, and uncertainty. Those who have anxiety on a regular basis or feel anxious for 6 months or longer usually have an anxiety disorder. There are 5 common types of disorders, including generalized anxiety disorder, panic disorder, obsessive-compulsive disorder, social anxiety disorder or social phobia, and post-traumatic stress disorder. Individuals may also have individual phobias, such as fear of flying or spiders. Everyone does not have the same type of anxiety disorder or the same exact symptoms. Seeking help is important to discover the type of disorder and the proper treatment options. Anxiety does not just affect a few people. It affects 18%, or 40 million people over 18 in the United States alone every year. Individuals often believe they are alone, but there are others suffering from the same problem. Each disorder affects millions and may be more prevalent in one gender. The breakdown for each disorder is generalized anxiety disorder, affecting 6.8 million adults, more women than men. Panic disorder, 6 million adults, more women than men. Obsessive-compulsive disorder, 2.2 million adults, men and women equally. Social anxiety disorder, 15 million adults, men and women equally. Post-traumatic stress disorder, 7.7 million adults, more women than men. Over 19 million adults are affected with anxiety disorder due to a specific phobia. This is more common in women. Women are more likely to be diagnosed with an anxiety disorder in many cases. Medications are used, but are not required in many situations. Patients also have the option of therapy treatments, such as cognitive behavioral therapy, anxiety management therapy, exposure and response treatments, systematic desensitization, relaxation training, biofeedback, and breathing retraining. Patients may use several forms of therapy or natural treatment options instead of medication. Some form of therapy is usually recommended, even if a patient is taking medication. Individuals with any anxiety symptoms should see a doctor to determine the severity and type of anxiety.